living with the new normal. It has been 6 months since we started living with COVID-19. The state government is fighting against this unfamiliar situation with conviction. When news came out in the second week of January regarding the spread of a new strain of SARS virus in China, the health department became operational with extra vigil. 3 cases were reported initially on the 30th January and 2nd and 4th of February. The first stage was confined to these 3 and we survived that stage without much bother. The second stage started in Kerala on 8th of March, where people who arrived from overseas were starting to get confirmed positive. 105 people were undergoing treatment in Kerala when the lockdown was declared on the 24th of March. By the time the second stage was over, 496 confirmed cases were reported. Among those, 165 were infected by the disease through contact. The third stage of COVID was accompanied by the commencement of the unlock process. This was the stage when people arrived in Kerala through the state borders, seaports and airports. Till date, 682,699 people have arrived here from abroad as well as from other states. A substantial increase in the number of patients was anticipated in the third stage. However, Kerala manages to keep its rate of disease spread below the predicted manner when compared to other states. COVID first-line treatment centers are being established in all districts of Kerala in view of the rising number of patients. COVID first-line treatment centers of CFLTCs are specially devised public healthcare centers to combat the spread of COVID-19. Kerala managed to stay out of the danger, the result of meticulous planning and execution of proper testing and treatment protocol all through these 6 months. An examination of the health sector alone will help one understand the frequency of interventions by the state government of Kerala. As many as 276 doctors were appointed in a single day for COVID prevention. Kasaragod Medical College was made operational. 273 posts were created. 980 doctors were appointed temporarily. In addition, recruitment was completed in 6,700 temporary posts through NHM. Nearly 1,000 ambulances were arranged for COVID prevention alone. 50 mobile medical units operated in different areas. Many hospitals were converted into COVID hospitals and necessary arrangements were completed. Our health workers have been able to treat and cure patients as old as 105 and 93. Quarantine facilities entrusted from ward-level committees to the administrative apex added vigor to the state's COVID prevention activities. The government implemented a package of Rs 20,000 crore to surmount the critical economic situation brought about by the lockdown. Social Security welfare pensions were distributed to 60 lakh beneficiaries. Monetary aid of Rs 1,000 each was distributed to around 15 lakh families who did not get welfare pension. Members of various welfare funds were given further monetary aids. Rs 1,742.32 crore was already distributed to 1,84,474 people through Kudumbashree. Food grains were freely distributed to 85 lakh families through the public distribution system. Free provision kits too were distributed. Nutritious food provided by Anganawadis was delivered to the children at their homes. Free food grain kits were distributed to 26 lakh students. Food was distributed through community kitchens and Kudumbashree to those people who suffered hardships during the lockdown stage. The government made arrangements to help the populace survive these hard times without additional burden. Necessary rebates were offered in this period to IT, industry, small-scale industry, and merchants occupying government buildings on rent. Such interventions are there in the unlock period too. The Subiksha Keralam project was started in the agricultural sector to overcome the slowdown in the labor and production sectors. A major revival was made possible in the agriculture sector through the project. 2 months of welfare pension and social security pension are being distributed now. Plans are afoot to distribute free food kit before Onam. Experts warn us that we will have to travel a little more further with COVID. So, it is time to stand united with the state to conquer this novel threat.